So, I think, where we're heading in terms of the development of drugs that are disease modifying is really not tackling only one problem, but many problems at the same time, because really dementia is many problems at the same time. There's another approach which is very well known right now, is like small blood vessel disease. Whenever we have a small blood vessel, little bit of leakage in the brain, little bit of reduction of perfusion of blood into different tissues in the brain, we get atherosclerosis. It's fibrosis of small blood vessels in the brain, and these blood vessels in the brain are very important, because not only they just help us perfuse the brain and send oxygen, but it also help us clean the debris in the brain. So imagine a city produces tons of trash and you don't clean the trash. There will be a time when enough is enough, and there's going to be spread of disease. And this is what probably happens in small blood vessel diseases. It is very well acknowledged out there in the field, from imaging studies and post-mortem studies, that small blood vessel disease plays a critical role in the onset and the development of cognitive decline and dementia in patients. So there are drugs, and I mentioned, the discordant domain receptor, DDR. DDR, or discordant domain receptor, is also a tyrosine kinase, but it has a magnificent, link, I would say, to blood vessel disease, because it regulates the formation, the expression of collagen, and other proteins like matrix metalloproteases, that are responsible for making, or constituting the wall of small blood vessel disease. So we know that if we activate DDR1, that leads to sclerosis. It's very well known in the periphery, like in the kidney and in the lung, but also in the brain. We know now that if DDR1 is activated, you have, fibrosis, and you have development of stiff and brittle blood vessels. As a result of the buildup of collagen around the blood vessel, narrowing of the blood vessel, blood cells cannot get through, not enough blood can get through, and then people will develop this, an ischemia-like situation in the brain. If you inhibit DDR1, you actually repress the expression of collagen and matrix metalloproteases. These are the proteins responsible for making the blood, constituting blood vessels, as I said, but also matrix metalloproteases are very involved, in triggering the inflammatory process. And it's no coincidence that when you see small blood vessel disease, there is always inflammation around this small blood vessel disease. We know that from, post-mortem studies. So inhibiting discordant domain receptors is probably a strategic option for us to go after, small blood vessel disease, and how and their relation to dementia. So there's a drug called nilotinib, which was FDA approved as an ABL inhibitor for leukemia, and we study nilotinib. I'm one of the people who study nilotinib in depth, to basically demonstrate that nilotinib targets this discordant domain receptors, and in turn discordant domain receptors limit the expression of collagen and limit the effects of collagen built up on small blood vessels, so that is an ischemia-like situation that leads to dementia or cognitive decline. And of course, last and foremost is is the development of gene therapies. This is a very specific kind of precision medicine. If we know that there is a specific mutation there, that the mutation leads to protein accumulation of some sort, let's say, in the cases of Parkinson's disease, like some of the autosomal recessive genes, some large pharma go after like the specific mutations. We rectify the mutations, and then we hope that we can reverse the disease process. We've had limited success there. There's also the issue of stem cells, in neurodegenerative diseases as a whole, and it's probably one of the Parkinson's disease is probably one of the areas where this thing has been tried the most, but I think even though it's probably 20 years in the making, it's still very embryonic. So overall, we need drugs and that are disease modifying that can treat cognition without worsening behavioral and or motor features in the patient. And these disease-modifying drugs are unlikely to go after an individual or a single process or single mechanism, but these drugs are very highly likely to induce multiple mechanisms of action to basically simultaneously create a harmonious, I would say, action plan. Okay, to get rid of proteins, to lower inflammation, and probably, to coordinate, between, an immune system in the periphery versus an immune system. We have to create peace between the periphery and the central nervous system. Thank you.